Hi, Dr. Vandana.
Hi, hi.
Okay, so we'll just start in a moment. I hope I'm audible and visible.
Yes, you are. And how about mine? Is it
Yes,
audible?
perfect.
Good then.
Okay, so hello everyone, and welcome to our live session, a very special session today, as we will discuss the do's and don'ts of skincare, especially during pregnancy. And we are thrilled to have Dr. Vandana Manoharan, a very respected consultant dermatologist with more than 2 years of experience helping women enhance their skincare routine and get the glow during this beautiful journey. So today, Dr. Vandana will help us guide through the skincare during pregnancy, what women should choose, what they should not choose, what should they look in the product while doing this. So these kinds of questions and more pressing questions will be answered in today's live session. So let's dive right into the session and get started. So first of all, Dr. Vandana, thank you so much for joining us. And I think I'll just start with the very important question. A lot of women are curious to know the first one, the pregnancy glow, right? Everyone knows, a lot of people, in fact, have that. So,
Yes.
can you tell more about the pregnancy glow and what causes it and how we can enhance it with our right skincare?
Yeah. First of all, thank you for having me here, and hi everyone. Yes, pregnancy glow is not a myth. Actually, many pregnant women will experience it. So it is there is a physiological and hormonal cause behind that. So usually during pregnancy there will be increase in volume of blood. Okay, so because of that, the skin is going to get extra nutrients and extra blood supply. So because of that, your skin is going to look always flushed, and also the rosy appearance is because of that. And also there will be elevated hormonal levels during pregnancy, like progesterone, estrogen. So all these things, they are going to act on your oil producing glands, and you are going to produce more oils, which make your skin look glossier, shinier and smoother. So that is the reason behind it. And if you want to maintain it, just keep it very simple. Just gentle cleanse it, gentle exfoliate it, and just apply some brightening serum, which is very safe in pregnancy.
Okay, so I think that's a wonderful advice. Now, we talk about skincare, and like in the market, there are the market is flushed with the skincare products, right? So, for a female that is pregnant or skincare during pregnancy, like if I were to supposed to be pregnant and if I were to choose a particular skincare product, like what are safe skincare during pregnancy? What should I look for during choosing a product?
Okay. So usually in pregnancy, as we were talking about the pregnancy glow earlier, some women will face so many skin challenges too. Like all of the sudden after pregnancy, they will start having dryness on the face. Their pigmentation will increase all of the sudden. All of the sudden, previously they would have used the same product, but when they try to use the same product during pregnancy, that will not suit them. That mean it's because so many hormonal influences is there, because that make the skin more sensitive than usual. So selecting a product during pregnancy is, it's very crucial, because some products when you are applying topically, they will get absorbed. Too much of absorption will be there. So if it get into the, if it get into the bloodstream, then obviously it is going to affect the developing baby also. Like products like tretinoin or hydroquinone, all these things, they have more absorption. And also some chemicals like paraben, phthalates, all these things is going to cause allergy to the patients. So I feel, we should be very careful in selecting whatever products which we are using. Let it be you have used that product previously also, that's completely fine. But then it is not like it is going to suit you during pregnancy also.
Agree.
It will not suit you. So always consult a dermatologist before choosing any product, but always stick to very basic.
So, like some females will have the glow and some will have dark spots,
Obviously,
melasma.
you can try using products which is safe in pregnancy, like vitamin E, niacinamide, hyaluronic acid, pentavitin. These are all some of the pregnancy safe ingredients which you can
Acha.
select.
Okay.
Yeah.
So, you mentioned a product hydroquinone, right?
Yeah.
So can you explain why these are problematic and like why one should avoid these products specifically during pregnancy?
Okay, so when it comes to, let's talk about hydroquinone only. Compared to other topical agents, no, there are so many topical agents are there. Whereas hydroquinone, if you apply topically, even on the skin, almost the study says 35 to 45% it is going to get absorbed inside the skin. So obviously, it is going to get into the bloodstream.
Agreed.
So we don't. I mean, there is a more chance it can go to developing baby also through the
Yes.
blood, right? So, but if you ask me whether it is going to cause any harm to the baby, I mean, the results, if you look into the studies, there is no sufficient human study which gives the effect of hydroquinone in pregnancy. And even there are some animal studies out there, even that is also not saying that whether hydroquinone can be harmful or it is not harmful to the child. So it is better to avoid. So that's why FDA, it has categorized this pregnancy, this drug into category C, which means the potential risk is not cannot be ruled out. So it is better to avoid such drug.
You also mentioned niacinamide, so it is safe, right?
Yeah,
Niacinamide.
yeah, yeah. It is safe. Yes, yes.
So I think a lot of viewers of ours would be concerned about, like you did talk about the pregnancy glow, we can how we can achieve it, and I think people facing with dark spots and hyperpigmentation. If I talk about, like I have oily skin and I'm acne prone and I do get pigmentation, but pregnant women, especially when they get hyperpigmentation, or how can they ease because major of their journey would be just going in googling stuff and
Yeah,
like
true.
that's so many questions in their mind they just want to know. So can you help them out and sort it for them that what can they do or how can they treat hyperpigmentation?
Yes, usually when you say hyperpigmentations in pregnancy, melasma is more common. Like they come with the pigmentation over the cheeks, nose, the patch of black pigmentations over the nose and cheek. Yeah, obviously. So I mean, this thing will get increased during pregnancy because of the hormonal influence again, and also because why means during pregnancy your melanin producing hormone is going to increase. So obviously you're going to produce too much of melanin compared to previous, I mean, when you are not pregnant. So during this time, it's very crucial to protect yourself from the sun. And if you are exposing too much to the sun, yes, obviously you're going to get melasma. No, I mean, there is no doubt in that. So if you want to get rid of it, or if you want to prevent it, please apply sunscreen even inside
It
home.
is a
Please,
must.
yeah, sunscreen. And when it comes to sunscreen, there is you have to stick to only mineral sunscreen. Again, as I was saying, that your skin is very sensitive during this period. So using a hybrid sunscreen or using a chemical sunscreen, it might irritate your skin. So it is better to stick to a mineral sunscreen, physical sunscreen, which is very safe in pregnancy lactation. So always stick to. And also once you got it, again, prevention for it can prevent. If you apply sunscreen, it is going to prevent the worsening of the pigment, number one. And you can also use, definitely you cannot use hydroquinone, which is the drug of choice if you are not pregnant, for melasma. But if you are pregnant, you can use vitamin C and niacinamide. Azelaic acid is very good and it is very safe in pregnancy. Even glycolic acid is also safe in pregnancy. You can stick to all these ingredients if you want to. And as I said, I mean, to prevent it, you have to be little cautious. You have to use sunscreen without fail. That is the one thing. Whether it is cloudy, sunny, doesn't matter, rainy, doesn't
So
matter.
you
If you stay inside
to
home,
swear by sunscreen, like do anything, let anything go, but have
yeah,
sunscreen.
yeah, yeah, please. Yeah, that is the thing. Yes, you have to.
Okay. So I think a lot of the very basicest, the most basic question I think everyone would be having, the most pressing question for all the female is the stretch marks,
Yeah.
right? So I think this is going to happen to them. So how can they minimize the appearance of stretch marks, or how can they cope with them?
See, first of all, stretch mark is nothing but a scar.
Yes.
More than that, it is a natural part of pregnancy. Okay, so as I said, it's the body's incredible ability to create a life. First of all, anyway, with time it is going to fade away. With treatment, it is going to fade away. Please embrace your journey and your stretch mark equally, which is equally important.
Okay, this is
And
completely the takeaway from the session that
yeah,
stretching is
100%. Yes.
embraced.
So let's, yes, if at all, if you want to, you need to know what is stretch mark is nothing but the scar. See, you're growing a baby inside you. Your body will change, your skin will expand, it will stretch. But when it is stretching rapidly, you will have some kind of tear in the dermis layer, which is the middle layer of your skin. Okay, so because of that only you are having that the collagen and elastin is much, so it is abundant of collagen and elastin, so because of that you are getting that stretch mark. So it is mostly because of genetic also. If your mother has stretch mark, your sister is having, yes, obviously there is a chance you will also get it.
And
So what? Yes, if you would have noticed many, many people, they would have not seen any stretch mark outside. But most of the people, almost 90%, they have stretch mark. How you can prevent is just simply moisturize it. When I say just moisturize it, don't apply moisturizer and leave it. Massaging. 5 minutes in the morning, 5 minutes at night time. You can massage even coconut oil. Very good for the stretch mark. You can apply coconut oil. You can apply moisturizer. And some study says even the moisturizer which has Centella asiatica ingredient and vitamin E, they have very good results. So here, massaging, it is going to increase the blood supply to that area, which is going to help to the another level. Massaging is the technique. That is what you have to do. You apply oil, you just apply coconut oil, doesn't matter. Massaging is what.
coconut oil is Indian household supplement. Very much.
Yeah, if you are not affording, people will say I can't afford Central Ayurveda cream or whatever it is. That doesn't matter. You have coconut oil.
Yes,
So you can massage it with, in the morning and at night, just massage it for 5 minutes.
right.
So that's more than enough. Yeah. And see, anyway, post pregnancy and postpartum, if you are not lactating, there are so many options out there to treat it, like MNRF treatment along with PRP, some chemical peels, and even tretinoin treatment. It is going to fade away. But then, as I said earlier, you have to embrace
Great.
this. That's very, very important. Yeah.
We also heard that the stretch marks are also called as the tiger scars, tiger marks,
100%.
right? So this is the marks you get for being a tigress.
100%, I agree. 100%, yeah.
Okay, so I think every dermatologist I have observed that there is one advice, one thing stick to. Like this is something they would just suggest to everyone. Like this is particular to everyone. So what is particular to you? What is the one advice you would like to give to our viewers that you think is a must?
Yeah, see, when it comes to pregnancy, skincare doesn't have to be complicated. Yeah, already the whole process is complicated. So I mean, skincare doesn't want to be complicated. So keep it very simple and safe. See, if you ask me, if you don't have any problem, simply gentle cleanse it, hydrate it with moisturizer, and protect it with sunscreen. That's more than enough. And stick to pregnancy safe dermatology recommended products. If you are not aware of what product to use, if you are confused what product to use, please, please, please consult a dermatologist before start using any products. Okay, so understanding what works best for your body during pregnancy is very crucial for both you and your baby's health. That's what I want to say. Yeah.
Okay, so just a simple skincare routine everyone should have. That's your go-to
Yeah, and
advice.
not only pregnant women,
Everyone
everyone.
should
Yeah,
have. Okay.
yeah, 3 step.
Okay, so let's have some questions from the audience. If everyone, the viewers, you have any question, please feel free to drop all your questions. Until then, I ask one question that is my own. The skincare, suppose a person is not pregnant, so skincare will change from one that to during the pregnancy, like they have to switch to whole new set of skincare products.
Sometimes, see, for example, before pregnancy, they will be using retinol serum. They will be using they would have melasma even before pregnancy. So they, I mean, his or his, I mean, her doctor would have prescribed hydroquinone to her
Okay.
without knowing that she is planning for pregnancy.
Yes.
So in that case, everything no, that cannot be used. As we have discussed
Yes.
already, that it should not be used. So obviously you have to, and retinol, as I said, retinol and retinol are same but different strength. So obviously you have to change all your products. You need to check whether it is pregnancy safe or not. Okay.
So, I think we have come to our end of the session, and it was wonderful to share these insights with you, to get these insights from you, and to have this you on this platform was really amazing, and I really enjoyed talking to you. So, thank you, Dr. Vandana, for being a part of this live session.
Yeah, thank you. First of all, thank you for having me here. It's been wonderful to share the knowledge.
Your audio went off. Okay. Okay. Okay then. Thank you, and we'll meet again for
Yeah,
another session, and we'll keep coming back with interesting topics. Thank you, everyone. Thank
yeah,
you for
thank you,
joining today.
so much. Thank you, everyone.
Bye bye.
Bye.